question, of course, what is sports medicine? So in other words, we're hoping you can give just a brief overview of what sports med means to you.
Here, you go first.
Okay. First of all, I'll just start and say I guess I'm kind of the one to blame for getting this whole medical student interest group started. Both Dr. Burkhoff and I serve on the board for the American Medical Society for Sports Medicine. And personally for me, the students are our entire future. And as Dr. Burkhoff knows, every meeting I try to push for something that's student related. And so this is, I think, the best thing that we have right now is really developing a great interest group. And so I was a faculty sponsor at Loyola, where I currently am, for our medical student interest group. And this is really an opportunity kind of at a national level to really get all you guys involved and understand what this is all about. So that's my little plug for the interest group. So it's an awesome thing that we have, and it's going to be driven by you guys. Whatever you're interested in, we can literally get just about anyone on these webinars. We can create content and really do some really cool things. So stay involved and tell your friends, and then get them out here. So me personally, what is sports medicine is we define it basically everyone in our society are non-surgical physicians who have done additional training or specialty work to take care of athletes and active people in a variety of conditions, which include musculoskeletal and orthopedic issues, primarily non-surgical, and also take care of active people, regular folks, and young people and old people, and many of us can cover and be involved with coverage anything from high school athletics, college athletics, NCAA, NFL, NBA, and all the glamorous stuff. But I actually still think it's taking care of every type of person, and promoting health and wellness is still kind of the hallmark of it. So I don't know. I'm kind of like broad thinking. So I'd love to hear Dr. Burkhoff's definition as well.
Yeah, thanks, Nero. And just so all of you know, Nero is your biggest advocate within our organization. He's understating how hard he works for all of the med students. And find him when you go to the meetings, glom onto him. He will be your conduit to getting more and more done, hopefully, in the future. To me, sports medicine is taking care of every part of athletic people. And that can be our kids who stay active. That can be, older people like Niru and I who still fancy ourselves as athletes. It can be our Division I athletes at the schools we care for, professional athletes. I work full-time in an orthopedic practice as a sports medicine provider, but we provide more than just the orthopedics. When I think of sports medicine, I think of it as the cardiac issues, the concussion issues, the joint and bone and muscle issues, the performance issues. There's more aspects to sports medicine than any one of us could ever practice in a given lifetime. So it's a wide open field for you to play in depending on where your interests are.
Great. So with that in mind, the definitions, what is a typical day like for you at work?
I guess we'll keep alternating, Dave. So I think for most of us that go into sports medicine, you probably have to check with your doctor first to make sure that you have at least a touch of ADD, because most sports medicine doctors are doing a ton of different things. I don't think any one day is exactly the same as the other, at least in my world, and I think most of us who are really pretty passionate about this field. So I think an average day could be anything from which may be just, going to clinic. A lot of us do a lot of work in clinics and sports medicine clinics in a variety of instances. So for me, I'll go into clinic, but I'm always surrounded by, I'm an academic, so I love teaching, and I'm surrounded by a student or a resident or both or multiple ones. And often we have, like, for example, like we have a journal club or, research review articles. I happen to do a lot of research too, so I might be interspersed with a bunch of phone calls and emails from my research students as I go through the day. And depending on the day, you might actually, leave to go give a talk somewhere or provide some coverage, either, training room, go out to the training room or college or whatever it is. And I think, each day is different, and often, like I just got back the last couple of weeks. I'm doing more traveling and maybe less coverage locally. I do a lot of stuff with tennis, so the Women's Tennis Association is a professional women's tour, and So I had been out to Palm Springs and Miami of Florida to help out with a research study at a couple of those tournaments. And I know it's a drag to go to Miami and in Palm Springs and possibly Paris, but you got to understand, like, none of those pay anything. So I think Dr. Burkhoff will kind of reiterate that all these things you do because you're passionate about, and you may not get payment for a lot of them, but you really believe in them, and it's what makes you you and what keeps you involved with the athletes. And I think that trickles down in the work I might do with those folks and the younger tennis players kind of listen to you a little bit more because you're involved with higher level athletics. So I think every day is a bit different.
I think Nero and I have fairly similar practices. I have a primarily clinic-based practice, so my average day may be clinic, but like Nero, I have a research interest, so I'm constantly trying to start up things, complete things, and finish them in between patients at lunchtime, any break I get in the day. We will see our athletes will come to us in clinic sometimes, oftentimes after a day in clinic. Some or one of us will head over to the training room. Depending on where you work, you may go to training rooms once a week, multiple times a week. The athletes might come to you. It's variable on the weekends. I don't do as much team coverage these days, so I get a little bit more of my time back to see my own kids play sports. But as Neera said, it's a passion that we all have, and we love to be out there with these teams that we cover, helping to cover basketball and football and high school and college, whatever it is that we love to do. Nero obviously has a love of tennis. I've worked with the NBA for years, so I get to travel internationally with the league and cover events all over the world. I get to go to Vegas every summer for summer league. So we all have figured out a way to include our interests and our passions into what we consider our jobs. And I think that's what makes sports medicine so much fun for most of us.
That sounds incredible to me. So you touched on this a little bit already, but since you work both on and off the field, so to speak, how much of your time is allocated to practicing medicine in a sports capacity versus non-sports care?
That's a really interesting question. John Lombardo, who's one of our founders of our society, when I interviewed for fellowship, I asked him that question. I said, how much sports medicine do you do? That's kind of the question we ask at the annual meetings and everything. And he actually said, sports medicine. He goes, every time I see somebody, it's sports medicine. He goes, it's a philosophy of how you take care of people, but not whether or not you're just seeing an athlete. Or if I see an athlete and they have abdominal pain, he goes, that's sports medicine. I got to figure out when they're going to the game. If I have a lady who needs to get back, who's like 40 years old, who's just starting to exercise, and she's off work or whatever it is, like, it's sports medicine to get her back quickly and work on these things. So I would say every day I do sports medicine and all day long, and sometimes it's involving high-level athletes and sometimes it's involving regular folks. And I really believe, and I'm the faculty sponsor for our sports medicine interest group, and I think, this discussion has come up at our board, I think that we don't need any more sports medicine doctors in the entire country just to take care of the elite level athletes. We have plenty of people between the Orthopedic Society and our society. There's a line of people, wanting to do some of these things that you might hear about. But we do need a lot of people to take care of regular people, like, up and down, from young people all the way up to old people, who, particularly those that want to stay active. And there's millions of those people, and you pepper in additional experiences. So I think that as young people are out there figuring out what to do, I really believe your best bang for your buck is working on plans to take care of a lot of people, because we view these things as public health issues. And I don't know, I think we have these arguments back and forth. I don't know what your thoughts are on that, but I really believe, like, you got to figure out ways to take care of everyone.
Yeah, I would agree. I'll admit I had more of a vision of my life as a sports med doc when I started, as I was going to have this clinic based of kind of 15 to 28-year-old elite athletes, and I could somehow feed my family on that forever. And I met some of the docs who were senior at the time, who I considered the doctors to the pro teams or whatever, and you realize that our practices are maybe just musculoskeletal practices or general sports medicine practices. And I see as many 50-year-old or 60-year-old men and women with knee arthritis who just want to stay active as I do professional baseball players who have sore elbows. and actually probably 10 to 1 in the reverse. So, no, I agree completely. I think your perspective of what is sports medicine, as long as it's appropriately broad, everything we do is sports medicine. Now, how much time I spend in clinic taking care of the 70-year-old rotator cuff tear versus on the sidelines actually doing sports medicine, it's really variable, and it's changed a lot over my 15 years. I used to do a lot more team stuff, and I spent almost every weekend either at football or soccer games. Now I spend a lot less time on the sidelines. I see a lot of the athletes in my clinic, and I kind of pick and choose a little bit more of what I'm going to do in my off-the-field time. So it's very up to you. There are docs who want to be team docs, and there are docs who want to be clinic docs, and there are docs who are everything in between, and all of which are great, and I think a perfect complement to what we know how to do and are capable of doing.
Great. So that's actually a perfect transition to the next question. So it sounds like there are many different ways ultimately to get to sports medicine. So there's primary care all the way to orthosurgery. So we were just wondering what you feel are the pros and cons of entering a sports fellowship through a specific specialty.
I will answer that question. Let me piggyback a little bit what Dave was talking about, is that both of us are a little bit more, experienced, seasoned in the field. So we're actually figured out ways to value our time a little bit more. So I agree with him. I spent 10 or 12 years covering Division I athletics. I can't believe how many hours I put in. It was great. Every experience was really cool. But now, he's one of our research gurus, and I do, a fair amount of research. And actually, I actually am really excited about studying kind of public health, issues in sports medicine and training in one sport and all that kind of stuff. And I actually really get excited about that stuff. And I'm putting my time in just different areas. And so now it's kind of speaking and doing research and going around different places to kind of work on those things. And my coverage stuff has actually gone down quite a bit. And if you asked me 5 or 10 years ago, I would have talked a lot about that. So anyway, I'm sorry to go back to another question. So I think when you're younger, you're going to do a lot more, is the bottom line, of on-field stuff. And that's why we like young people.
We don't have to do it.
So yeah, this obviously is a question that comes up with our faculty, sports medicine interest group at our own institution, but what paths there are. So there's a surgical and non-surgical path. So obviously orthopedic surgery is the only path for surgical sports medicine fellowships. And I think those people who are interested in surgery is really the most important part of it. So your fellowship actually will, depending where it is, will involve a lot of different types of experiences and maybe, a lot of different types of coverage. But one of the things is learning the skill set of surgeries related to sports medicine. So that a lot of that's arthroscopy. So at least, and that's my impression. And I'm not being biased. Dave's already smiling, but it is a surgical-based fellowship. And I train with orthopedic surgery fellows. So, we had a little bit of a different, experiences with my father-in-law trying to get hold of my wife. So he's probably going to call me next. Sorry. So then in the non-surgical fields end up being anything from family medicine, emergency medicine, pediatrics, PM&R, and internal medicine. And I think just the evolution is that it ended up being a lot of family physicians, because some of the original fellowships started out of family medicine, and then they grew fellows, and then they train, and then they become attendings and everything, and then they have their own fellowships. So anyway, a lot of different paths, and we're totally biased to the non-surgical pathway. I'd have to say, treat the whole person, look at all aspects of them, and make a little bit less money. If you do it, right, Dave?
Or a lot less, but.
Yeah, or maybe a lot less, yeah.
I think, so I come from an ER background, and Nir and I were joking at the beginning, there's just not the bulk of non-surgical people who do sports medicine. The overwhelming majority is still from a family medicine background. So if, Jesse, your question is kind of what's the most common pathway for an avenue to sports medicine for a non-surgical doctor, I would say it's still family medicine. I know for me, and one of my interests in both being involved with Niru and his help with med students and residents is I came from an emergency medicine background. There was no sports medicine interest doctor, anybody where I trained. I trained in the Bronx, and it was something I kind of found on my own and had to pursue well after I finished my residency. So it's a different residency, it's a different pathway, and there's still not as many mentors and people out there to help guide you, but I'm not sure it really matters whether it's Niru with the family med background or me or people in PM&R or PEDS. I think we can all help people to figure out a way to get where you want to be. I know, the most important thing is, if you're interested, is to show an interest and figure out ways to get involved early on. And that's sometimes where if you pick a specialty where you don't have mentors or people doing it where you are, you have to work a little bit harder to find that. But the opportunities are always there.
Yeah, that was my question, Dr. Burkhoff in particular. We know usually about the family med route and then the ortho route, but we don't hear much about the ER route or the PMR. So we were just curious, do you feel like it was harder from ER to get a sports fellowship?
I do, and maybe I'm biased. I think for me it was definitely harder because I didn't have anyone to guide me when I was figuring it out. I was kind of a little bit on my own. It was also harder because we didn't have anybody who did that or was in sports medicine. So my sum total sports medicine exposure after 4 years of emergency medicine training in New York was my own business. I started doing sideline like triathlon coverage. So I had to do it all on my own. And I found I took a few years after I finished working as an attending, going back and doing all of the things on training rooms and sidelines and stuff to kind of learn the stuff that a lot of you guys, or a lot of those people who were in family medicine, maybe had opportunity to do during residency. So I definitely think it's a little bit more challenging in some ways. On the other side, when it comes to sideline coverage and event coverage, I love the fact that I'm an emergency medicine trained doctor. I feel like I have such a great background when it comes to event coverage and emergency management that it complements what I learned in sports medicine really well. So maybe it made it a little more difficult, but by no means any sort of impediment.
Oh, great.
I would add that Jesse, I would add that it's not just where you started, it's where you end up. And Dave and mine, I don't know if that's the right grammar. We probably have very similar practices and very similar days, and we're both academic, and we both do orthopedic or sports medicine clinics, I should say, and cover and work at university, and so our practices are very similar. And my practice is incredibly different than everyone else in family medicine, and I'm sure his practice is incredibly different than everyone in emergency medicine. And I'll be, joining a group actually, in Emory next fall, and they have a lot of PM&R sports centers, and our practices will be very similar, but very different than our PM&R family medicine colleagues. So I think it's where you end up. It's not just where you start. The only difference is that, some fellowships, but not all, will only want, for example, the type, like a family medicine resident applicant, so that they can do continuity clinics and things like that. But you can always work around that if you have to.
Okay. So you pretty much answered the question. Perfect. So once the fellowship is done, we're wondering about the opportunities that are available to practice sports medicine. So we've talked a little bit about the outpatient clinics and being a team doctor. Are there any other types of ways you can implement this type of knowledge?
So, Dave, do you want to do this, or do you want me to?
Sorry.
So, basically, there's actually...
No, go ahead. I actually need to hear you because my computer froze. I have no idea what the question was.
Okay, good, yeah. So there's a cajillion ways. You have a great smile on the camera still. I don't know if everyone's able to see this, but I thought it was live. We actually had to stop at the right moment. But so your job after you're all done, I ask people when they're starting, when they're interviewing, I said, what do you want at the end of this? Because everyone has a different model in mind. So when I first started, a lot of people thought 15 years ago wanting to do half and half. That's kind of the big thing. You do half primary care and then half sports medicine. I did that for a long time, and there's some people who are still successful and able to do that. Even like our past president worked at UCLA, John DiFiore, and he does half He does like primary care clinics, family medicine clinics. He goes out and he's the head team doctor for the UCLA athletics and does, sports medicine clinics. And so I think that path is absolutely possible. You can work in a private practice and only do, musculoskeletal. You can do half and half there. You can work in a big group. People who are assigned only to be like a Division I team physician, because primary care sports you kind of handle everything, right? So all the medical and musculoskeletal and all the coverage. So you might, be the head team doctor for like, we have I have a colleague at Purdue, for example, and just that's all you do and then maybe combined with student health experiences as well. And so I think every job, that's why we're always curious what other people are doing, because every job is quite different, and the path how you get there may be a bit different as well too. Dave, are you able to hear?
I think, Jesse, my computer froze a little bit when you were asking the question. Is the question, what are the different things you can do?
Yeah, the opportunities post-fellowship. We know a little bit about the outpatient clinics and being a team doctor and primary care. Just wondering if there's any other types of opportunities you can get involved in.
Absolutely. So, at Carolina here, it's interesting. So we have a bunch of primary care sports docs, and there are 3 totally different types of us all within one institution. So I'm a primary care sports doc, ER trained. I work full-time in orthopedics. My practice is basically musculoskeletal, like Niru, kind of a research interest, but a much more clinical slant. We have 3 primary care sports doctors who work 100% out of student health. They're our main team docs. They only see students. They take care of all of the teams. They're at practices. They are 100% kind of sports medicine based out of our student health. And then we have one doc who is part family medicine. He works a little bit with us in orthopedics, and he works some in student health. And he's kind of a hybrid. He still does some family medicine. He still has an appointment in family medicine. He's our fellowship director, and he kind of does a little bit of everything. So even just within our one institution, 5 of us who all have basically the same training have 3 totally different day-to-day jobs. It's really, a lot of it is kind of, as Neil was saying, kind of make it what you want it to be based on where your interests are. And we all change over time as you develop new interests, or maybe lose a little bit of the love for the sideline. Sometimes you find a new passion.
Well, here's an interesting question to go off of that. How is the current job outlook for someone in sports?
That's $1 million question.
Yeah.
That's a great question. So like I said before, both of us sit on the board, and we're 2 of I guess a small group of people who help trying to figure out what's best for the whole organization, the future of this field of sports medicine. And that actually, so I say either there's very little job opportunity, or there could be incredible job opportunity. I think it's how we design what we think the opportunities are. And I believe right now all the fellows are getting jobs. Everyone's coming out and getting jobs. We have about 175 spots, I think, that come out throughout the country. So everyone ultimately ends up with a job. Does everyone end up with their dream job right out of the gate? Probably not. Do all the orthopedic sports fellowship trained people end up with their dream job right? I think probably not. But I think, like Dave said, you ultimately get to that point. I believe, again, if we work on more broad approach to taking care of patients, musculoskeletal ultrasound is a big thing that's come up now, where we diagnose and treat conditions right on the spot, and we're more conservative and we show the effectiveness of it. There won't be enough people to train to be able to take care of the number of patients that would need us. If we train 175 people every year who all want to be NBA or NFL team physicians, well, there's only 32 NFL teams. There's only 32 32 NBA teams, and we're going to run out of spots really quickly, right? And I would add, I'm actually joining a practice that has the Atlanta Falcons and everything, and I actually never once talked about them being able to be involved with it, because like David said, you figure out where you want to put your time in. Actually, this is Dr. Foley. She's calling me right now, so I'll have David answer, okay?
It's yeah, I think there are plenty of jobs for everybody going to be done for years to come because the entire paradigm of what we do and what is non-operative sports medicine or musculoskeletal care and how we approach healthiness and active lifestyles. Healthcare is changing. How we approach patients is changing. Just the fact that, in the old days, every time you sprained your ankle, you went to see the orthopedic surgeon when, in fact, there may be other people as well or better trained to take care of these non-surgical injuries. Orthopedic practices are now realizing that there's a niche here that we fill. I think there's a lot of opportunity, and Nero made the best point, which is we don't all get to walk out of fellowship and walk into our dream job, but over the course of a career, you can find your way into just about anything if you work at it.
Okay, and this is something I'm actually really curious about. What do you feel are the differences among levels of competition? For example, working with high school football players versus traveling with a professional NFL team?
So, I do the NFL combines every year and get to, I interact with them. I train with the guys who take care of the Colts, and they're good friends of mine, and the guys from the Bears. I'm in Chicago now and all these things. And obviously, probably all of us have covered high school football at some point. And I think there's incredible experiences that you gain from both. I mean, there's just, when you're dealing with NFL, it's so glamorous and, but it's also, it's an incredible amount of work and attention to a small group of people. So you have to commit to the fact that you're there. Like if you're an NFL team doctor, you are spending 9-10 months of the year, almost, every day, 7 days a week, there's some issue going on, and then you're physically expected to be there quite a bit. It's glamorous, but it's also a ton of work for a small group of people. And then depending on your high school, we take care of underserved high schools, and they are so pleased that you just step on the field that for any game, even if it's an hour, and you have to leave because you have, other obligations, they're just thrilled that they have any care at all. So I think it's kind of what you want out of your experiences. And I think over time I've matured, and I always look at, I try to do both, but I was really excited about the high level experiences. And honestly, my whole research focused on the young athlete and these kids and trying to increase participation in young folks and get away from the kind of the craziness of youth sports. So I think you'll find, each of you will find what's most exciting about the path based on, again, what's most important to you.
Yeah, I think it's interesting. I get to interact with athletes of the day-to-day variety and then professionals as well, and I find the biggest difference to me isn't the medicine, it's the politics that go along with taking care of athletes at that level. It's no longer just the athlete, it's the trainer, sometimes it's the agent, it's the coach, we're not trying to get them better, we're trying to get them better for tomorrow. The expectations are different, obviously the win-loss of getting somebody better quickly versus not kind of, decides that day if you're the good doctor, and tomorrow if the guy doesn't get better, then you're the bad doctor. So the pressure, you're only as good as your last failure. The pressures are just really different, and I enjoy. We always joke in North Carolina, everyone's kid is going to be the next famous blank, and you just fill it in because every 12-year-old I see whose parents don't want to take them out of the soccer game because they're going to be the next Messi. It just seems like I spend as much time enjoying my interactions with the young athletes. It's just a different flavor. It's a little less of the agent-driven, get me back tomorrow, but it's the same pressure of, Susie can't miss this cheerleading competition because then she's never going to make it in college, even though she might be 11 right now, not even like cheerleading anymore. So it's a lot of fun, and you'd be surprised the athletes or groups of athletes you seem least interested in now may turn out to be, like Neeru said, the ones you focus your most attention on later in life.
Okay, I'm going off script a little bit, but I'm a huge Oregon football fan, and I would love to end up there someday as a team doc. So I'm just wondering what it's like if you have to withhold someone from playing or do you ever run into problems with a coach or anything like that?
No, actually, every single coach I've ever worked with has always agreed with everything I've ever done, and it's actually really easy. It's in fact every parent has also agreed with every decision I've made, and there wasn't a single time where anyone questioned my decision making. It was awesome. It's been awesome. I don't know if Dave, if you've had the same experiences.
Yeah, see, therein lies the difference. That's why he brought me on this panel, because I've never had that experience. Everyone questions everything. It's the hardest part of what we do.
Yeah, you're always going to be questioned, and it's interesting as you get you have to have a little bit of a thick skin, and you'll get questioned when you take people out. You'll get questioned when you put people back in, and these decisions that you see a lot, a fair amount of them are people we know. Like when you're watching on TV, usually you look and you're like, ooh, I really feel bad for so and so at that game because it's so magnified, right? And that goes along with the territory. Again, the higher level athletes, I cover professional tennis, for example, and I enjoy it. However, I also don't enjoy it because I get analyzed at literally every decision that I make. And if I take care of a junior tennis player, usually they just trust whatever I have to say, and then they go on and they listen to it. So again, I think, it goes both ways. But yes, there is a lot of that. Dave, I'd love to hear my school stinks. Like, we're mid-major. Like, Dave, you're actually the place that's good. What you should tell them what experiences you have.
It's great fun, Jesse. I enjoy. Again, I think sometimes the medicine is the easy part. It's figuring out before you see somebody what their plan is going to be, before you even know what's wrong, trying to figure out how to finesse the situation so the coach or head athletic trainer feels like they made the decision that you wanted them to make, so that you can feel comfortable with what you did. And sometimes, the hardest part of doing what we do is staying true to what you think is right when the coach and the trainers and everyone are pressuring you to do something differently. And at Carolina we have some good players, and some of it is, look, you push the bounds a little bit and you learn how to maybe get people back into play sooner than you would for that 15-year-old who you saw in your clinic, and you start thinking outside the box very quickly when you're told you have 1 week to get somebody back. So you spend a lot of time calling friends that you see on TV and asking them what they did to get their athletes back on the court or field quickly. And it's fun, and it makes you sweat and gives you ulcers all at the same time.
Thanks for answering that. What do you find most rewarding about your career?
And I apologize. I'm actually texting Dr. Foley, who's trying to get on, but I think she's at a meeting and she's trying to get on. She's our pediatric sports medicine physician, and she's trying to get on her phone. So I don't know if that's possible, Chris, but maybe if you can email her while I'm doing this and maybe try to help her out and see if you can, help her get on. But, with sports medicine, I actually spend most of my time talking people out of sports medicine as a faculty sponsor. I think Kirsten Goody's on the call here. She's at Loyola with us, because I want to figure out who the right people are, because in the end, there's so many things that I enjoy about it, but I don't think it's right for most people, because you have to put in all this extra time. You have crazy schedules and all these things. But I don't know. These days, as I actually just impacting kids right now in sports and making good decisions about that is probably, in particular for me with tennis, because that's my love, and everyone has their specific niche that they found, and really doing research in that area to help lots and lots of kids make good decisions in the future has been by far the most rewarding thing now. Before, it was probably helping college athletes get back and be competitive and try to make NCAA tournaments, because we are at a school that doesn't make NCAA tournaments, like Dave's school. That was actually one of the highest things that I rated for a number of years, but again, things have changed a bit for me.
The thing I like most is that it's interesting to me every day. I frequently find myself sending texts or emails back to those same athletic trainers I said I was sweating, thanking them for letting me take care of these athletes with them, and be part of the big picture. I have a ton of fun doing that. I love the fact that I get to go, be at a NBA event one day. The next day I'm in clinic taking care of your grandmother with her knee arthritis, and in between seeing 5 other varieties of musculoskeletal or other sports problems. It's the ER in me that likes the variety with still a focus with a niche, and to me that's just it's a perfect mix.
Great. So one last question for you before we're going to turn it over to the students, but what are some ways that the medical students at this stage in our training can get involved in sports med and I guess ultimately increase our chances of getting a fellowship in the future?
So doing this right now, in fact, we started this, I've started a lot of different things to give people pathways, like Dave mentioned, is showing early interest and consistent interest throughout. So those of you who are involved now, not just in leadership positions, but actually, just involved in interest groups, going to, listening to webinars and getting to know people, like you see us going to the annual meetings and then getting involved locally at your own medical school or wherever it is. If you have create an interest group within your own medical school and taking leadership roles in these. I mean, in other words, like being the person who started. And like I did like fundraising tournaments for, the children's hospital with tennis, and all these things are consistent. Now like I'm kind of a tennis doctor or whatever it is, but showing a consistent pathway all the way through. And getting to know us personally. I think you see both Dave and I are pretty relaxed, and we're in our kind of sports gears. When you're at meetings and we see you in person, you shake your hand and you have an opportunity, and then later you rotate or something like that. And we remember all of those people who are involved, and people call us, or we run fellowships, or they call us and they say, what do you think about this person? I say, yeah, I remember them when they were a student. And I think that's really the name of the game, how you get fellowships.
Yeah, I mean, I'll tell you guys, as part of our faculty, when we're looking at our residents applying for fellowship, all of you already have the smarts and the credentials, right? You are already in med school, and when we get to residency, you all have good board scores, you all have good fellow residencies that you're coming from. So to me, the most important thing, and I think to a lot of us, is who's really got a passion for sports medicine? Who showed up at the end of their last year of, residency and went to 2 high school games and got a letter from somebody, and now they want to do sports because they're not sure what else they want to do, versus who started being, and no one's asking anybody to commit to a specialty when you're a med student, but if you have an interest, or when you have an interest when you're a resident and you think you're going down that road, show a consistent interest and a pathway that you really have a desire above and beyond just the opportunities that are handed to you. And Neer is right. The more you know, the more you know. And all of us, it may sound like a big organization, but it's really a big group of friends. Everybody knows each other. We all like each other. We mostly like each other. And we, if you know people, and I remember, Jesse from these things, and years later we circle back around and we have the same conversation. On paper, if everyone's equal, I'm going with the people that have shown a long-lasting interest.
And specifically, if I can piggyback that again, and I'm sure Dave has we were just talking before the call started, how many former students we know, and we search them out. We will find them and want to hire them, and people remember you. But the 4 areas I think that work best in our clinical, so finding clinical rotations, so you can see the people that you want to maybe one day work with. Outreach, so being at games, events, whatever you can do in your own community or whatever else you can, show that interest. It's always above and beyond what everyone else is doing, because that's what your career would be like. And then academics, so while you can't present at conference, if you're really good and really lucky, you might be able to, but attending conferences in sports medicine locally, or particularly AMSSM. And lastly is if you are lucky enough to be able to do some research. And I've had a ton of medical students who are phenomenal researchers, and almost every study I do involves a medical student. So if you find, again, faculty that you can work with on that. I think those are the 4 big ones to get in.
Okay, well, thank you so much for your advice so far. Okay, Chris is in there, so I'm going to turn it over to you.
All right. Well, thank you guys very much for answering those questions for us. That's kind of the pre-made questions we had. I think that really gave us a good idea into what sports medicine is all about. At this point, we want to turn it over to any students that have any questions that are listening in right now. If you have any questions, you can just type them in the chat box, and we'll ask the physicians those questions. In the meantime, while you're typing those, Jessica was going to talk to you a little bit about our contribution to the sideline report.
Yeah, so while you guys are typing those questions in, I should quickly just mention we'll be featuring one of the charter schools, so one of the medical schools that have applied to be a charter school with AMSSM in an upcoming edition of the Sideline Report. That's the magazine issue. So keep an eye out for that when we call for submissions if you're interested. We'll have you write an article basically to represent your school's sports med interest group, something interesting that you've been doing or certain teams you've been supporting. So keep an eye out. We'll send out an email maybe in the next month or so, and it's kind of a way to nationally represent your school and get more involved with AMSSM. Krista, do you have any other questions before we talk to the students? Questions?
No. I think Dr. Foley, sorry, I know I introduced her, but I don't think she was able to get on today. She was the pediatrics speaker.
I was to say one thing on behalf of her. She actually is someone who came as a resident in pediatrics and approached me. She's interested in tennis and approached me as a resident. She's either an intern or a second year, and was at the academy meeting and showed a consistent pathway. And now she got a great fellowship and she got her first job and she's very passionate about her field. And if people ask me about her, it's very easy to say, I knew her when she was a resident. She's always been there. And now she's doing great as an attending, and her career will be great. And again, it started earlier with consistent path. Peds is an excellent choice as well. It's just that there may not be as many fellowships because it's not including adults, but there's a lot of peds sports medicine doctors who also see adults, so it is possible.
Absolutely. And all right, we are getting a couple questions. So the first one was if there's any advice on how to get involved in research if they don't attend a big research-based medical school.
I'm going to Dave Handel. He's our research guru for our society. For
I think the best way to get involved is to just get yourself connected. I know Niru, myself, there's tons of us who always have great ideas and great projects, and often research, especially research from the med student level, it doesn't have to be big prospective interventional studies. It can be surveys. It can be, looking at a group of people. We don't have to be at the same place as you, or you don't have to be at a big academic institution to do a project. And I often get an email or a suggestion, whether it's from people at other places where I'm not, that say, hey, I had this great idea. Could you help? And sometimes we can just help develop an idea. Sometimes it may be we can connect you with one of us or a mentor, somebody who could help develop a project. And that's where the local meetings, whether it's ACSM has regional meetings, or coming to AMSSM, and I'm a big believer in networking. I think the more you network, the more you can grow your pool of people to call upon. And if you're at a small place that doesn't have research, we have tons and tons of people in our organization who are passionate about it that I think would be happy to help.
And we can connect you geographically. We're going to work on actually a list of people geographically for the interest groups so that you can figure out shadowing and research opportunities that will be particularly that'll be local in your area at least. And doing things in person is the best way. Then you can email them and arrange a meeting. Dave, your microphone's off a little bit. It got a little quiet there.
Oh, again. Sorry, I think my internet's cutting in and out.
Okay.
Is that better?
Still a little bit quiet, but Chris, why don't you keep going?
Sure. All right. The next question is, when did you guys know that you wanted to be in sports medicine? Was it during medical school, or did it occur throughout residency?
For me, actually, it was the first day of my third-year clerkship on family medicine. It was a lecture I was given by a guy, Bill Knopf. Actually, he was a primary care sports, and actually he played tennis in college, and I actually came up to him afterwards, and he just seemed cool. I was like, let's go hit. I need someone to play tennis with. And then we would hit every week or two, and he would tell me more about his job, and I thought it was I couldn't even believe it. This was like about, gosh, almost 20 years ago now, and I couldn't believe there was actually a job that you could get paid for doing those kind of things. And he was involved in teaching all these things. So I actually kind of figured it out early only because it's mentorship. You found someone early on that did it. And I think you guys are even earlier than that. So I think you have an opportunity to learn these things early. So I arranged rotations right away, and I got a lot of experience going into residency knowing that I wanted to do it.
Okay.
Dave, are you able to?
Yeah, can you guys hear me now?
Yes.
Yeah, I can hear you.
Okay. The answer is no, I was not. I went to medical school. I always wanted to be a plastic surgeon. But I'm old enough that they didn't have those. I had to do it 7 years, and 5 years of general surgery turned me off to that. So I decided to be an emergency medicine doc, and realized very quickly as an ER doc that I spent most of my time just wanting to do triathlon and other sports. And then I thought, well, if I'm a doctor and I like to do sports, why can't I combine the two? So I kind of developed my interest as a resident, starting my own little business, being the doctor on the sidelines, literally on the sidelines of these tiny little local triathlons in New York. And as I exposed myself more to it kind of on my own, I realized, God, this would be great if I could figure out a way to put the two together. Where I trained, there wasn't any sports docs. There were no ER sports people at my program. So I kind of found my way there a little bit on my own. And then afterwards, I ended up down at Duke as an ER attending, where they had a really robust primary care sports department. And I was just very lucky to have the faculty that were there that kind of took me in and let me started to work with them and figure out kind of what it was to be a sports doc. So I got a little bit lucky. Some of it's the right time, the right place. Some of it's just a lot of, as I always say, sweat equity. I decided that's what I wanted to do and figured out a way to do it.
Absolutely. Thanks for answering that. All right, so the next question up is basically choosing a residency program. Is it beneficial for you to choose a residency program that includes a sports medicine fellowship in-house? And if they don't have that, what's the best way to get involved in or connected with sports medicine if they don't have that fellowship?
That's a great question. That's gotten easier over time. I thought that was an absolute must when I was applying, and I got my second choice for residency. And one of the other questions was, well, why'd you choose it? Family medicine or whatever it is you chose. But my mentor that I did was he was a family physician that did sports, so a lot of it is role modeling, right? But so I ended up going to a program that did not have it, and the cons were we didn't have as many structured experiences. So that kind of, you didn't have as many structured lectures and all these kind of things. The cons were you weren't around a lot of other people who wanted to do sports medicine. So every opportunity, people always came to me whenever there was opportunity. So I had to search a little bit on my own. So I think overall it's probably a little more beneficial to go to residencies with it because there'll be more structured experiences. But you can certainly still get into a fellowship without it.
I would agree. I think it was more difficult for those who don't. That doesn't mean it's impossible. I think the more people you're around who do what you want to do, the easier it'll be for you to have exposures and opportunities. So, two are equal in your mind and one's got more of a sports flavor and that's what you're interested in. I think you would not do yourself a disservice, the double negative there. I think it would be a good thing to go, anywhere that provides you opportunities.
Definitely. Those are good answers. All right, so the next question's a general question about your residency choice, why you guys chose to go into family medicine and emergency medicine.
Okay. So one thing also about not having those opportunities, even if you go to a place with it, it's all about you. No one's going to spoon feed you in sports medicine. You basically dictate your future. So if you are really interested in this, then you find every opportunity. That doesn't stop when you're an attending, and even for Dave and I, if we want to something, we hunt people down, and we try to get what we want. We want to get the experience that we want. If I want to be involved in something tennis related, I'm calling people, emailing USTA, and saying, look, I need to do something with this, and for residency for me, I really felt engaged with both adults and kids, and I felt like I could impact the whole spectrum of seeing adults and kids. So I knew that just the way it was set up, the most family medicine choices came through family medicine. Hey, there's Dr. Foley.
Hi.
I'm gonna start talking and then have her jump in and say hello, real quick. So, but anyway, I could see adults and kids, and I had a mentor who did it, so it was an easy choice for me. Cassidy, you want to introduce yourself?
Hi, I'm Cassidy Foley, sports medicine trained and pediatrically trained. Very sorry about the connection issues. I double booked myself, so speaking on a board tonight. But I'm in Atlanta currently and treating a lot of female athletes in sports medicine and kind of doing the pediatric orthopedic route.
And why did you do a peds residency was the question.
So I was a female athlete growing up. I did figure skating and dance for years, and so you kind of reach your peak as a 13-year-old. So that was kind of when I was doing a lot of intense sports, and there was no one ever to kind of take care of female athletes. All of the doctors that I would see would kind of brush it off. They didn't really know how to handle it, and so I kind of dedicated myself at that point to wanting to treat this and wanting to be somebody that these girls could reach out to and get some help from in the future.
Great. Dave? Good. Dave, are you there?
Oh, yeah, I'm still here.
Oh, yeah. You want to go ahead?
What am I answering? I've already forgot what the question was.
Oh,
why did I choose my specialty? Right. I chose emergency medicine.
Well,
Yes. I'm sorry. I chose emergency medicine because I think I said it wasn't what I went to school to be. I happened to be at a place that had a strong medicine program, and as you can tell by my attention span, I have a lot of it. So the ER fit my personality quite well, and it still does in a lot of ways, but I've found that although I enjoy emergency medicine, the niche of sports within the emergency medicine background to me it's a great compliment.
All right. The next question is asking about other fellowships, like concentrating on like ultrasound and stuff like that, and asking about how that can be incorporated into sports medicine as well, as far as pursuing other fellowships outside of sports medicine.
So I can talk about that a little bit if you want. I just graduated, so I think a lot of the newer programs are incorporating a lot of ultrasound in, that you don't need to go to a separate fellowship for ultrasound. I trained at Harvard at Boston Children's, and they have an amazing ultrasound technician there who trains you during fellowship. And I'm feeling pretty confident in the basic skills coming out of fellowship. I don't know if that helps.
Yeah, I would add, Cassie's right. I'm an old timer, and so is David. Like, we didn't have this kind of stuff in our fellowships. Mine was about 14, 15 years ago, and so I'm actually catching up to people like Cassidy because they all learned it during their own fellowship. So I take a lot of extra courses. But if you go into fellowship now, we're probably going to have a required curriculum in every fellowship for any of you who are on the call now. So if you do a fellowship, you will get all the training and have to meet competencies. And all the other aspects, cardiology and all these other things that are medical, they're required as part of your competencies in a primary care sports medicine fellowship. So it's not just like a little peppering. Like you have to actually have some, pretty good experiences and knowledge base in those areas.
Yeah, I would. Coming from an ER background, we were early ultrasound adopters in the point of care ultrasound model, and I found myself to be the same when it came to sports. As Neeru said, this will be part of all of our fellowships as a required component in the very near future. And, our fellowships are all a little bit different based on where you are and, what teams they may or may not take care of and what the attending specialty interests are. But as Neeru said, the overall breadth of what we have to learn is part of what we have to learn. And I think, the opportunities are there. And that's, when you get to picking fellowships, as much as you're interviewing to get a fellowship, you're also picking fellowships that have the parts of it that you want, that are going to help you to become the doctor that you want to be.
Absolutely, and there's so many different ones out there. They all will advertise to you when you interview with them what kind of sports teams they cover. So in particular, Boston covers the Boston Ballet, which was my passion. They also cover United States Figure Skating Association. But other places, they'll cover equestrian sports. Or I know like Philadelphia, for instance, they have ties with 2 national agencies. I think it's, they do Eagles coverage, and then they also do hockey. So depending on what you're interested in, if you want to do big-time college, you can definitely find that, Ohio State and other places. So whatever you're interested in, you can tailor your fellowship training towards.
Absolutely. That's extreme. All right. And it looks like the last question is going to be from a third-year medical student working on setting up their fourth-year rotations. If you guys had any suggestions on how to set up away rotations and get the most benefit from that if you're wanting to go into sports medicine.
Yeah, I actually think it's pretty important. And one of the things we are going to work on, Chris and Jesse and the rest of our medical student interest group, is creating a good list for those opportunities. But in the meantime, if you go on the AMSSM website, it lists every sports medicine fellowship in the country. And if you go through that, you will, I think, geographically first figure out where you want to be in your geography. And then I would say almost all of them, I won't say all of them, but I would say the majority of them will take fourth-year students in some capacity. And you can just contact those institutions that you're most interested about. Some of them have long wait lists, and some of them you can get in right away. We don't have a fellowship, but we take fourth-year students, but I'll be transitioning. But I don't know, Dave, or how you guys handle that, or Cassidy.
I think you got to figure out. If you're really interested in sports, you start doing your research ahead of time and think about what you want. For someone like Cassidy who knows that she had an interest in dance, I'm sure finding programs that had that focus and doing rotations where you could get exposure to that would be important. We have a kind of a big D1 college feel at Carolina, so if that's what you were interested in seeing what that's like, then find a place, or if you have two, find two that are a little different, kind of see where the differences are and try to figure out what interests you about sports medicine. I think most of our fellowship programs entertain or will take rotating students and residents, so you just have to be very proactive and stay on top of things.
I totally agree, and especially in pediatrics, I did not get very much exposure whatsoever, except maybe patellofemoral pain, to sports medicine and orthopedics. So I did a lot of away rotations. I really aggressively pursued shadowing the sports med and orthopedic doctors at my residency. And so that was kind of ongoing. I'd go whenever I got an afternoon off, which you occasionally do. And then I did 2 aways, one in surgery, quote unquote surgery, but it was orthopedic surgery, and then one in sports medicine. So it does really, when you're thinking about fellowships, it really does. It's more based on how interested you are and what your experience has been, and kind of more your extracurricular activities. So I think that's really important to show your interest and to try other things out, because that's also how you learn what you want, and that's how they get to know you and know if you're going to be a good candidate. I highly recommend it.
Chris, maybe we're going to answer Matt's last question. Matt's asking a lot of really good questions here, and I'm curious what year he is in medical school, if you can type that in.
Where's the question?
Chris, are you there?
Yes. Yeah, he said he's an M4.
Okay. So I'll go ahead and try to, he just mentioned family med. Good. Congratulations. So the question is, what will you get outside of your fellowship? I will tell you, I train literally every single family medicine resident that has come through our institution in the last 12 years, and so it's about 140. And I can tell you now that their 1 month experience is literally just a tiny little appetizer of what sports medicine is and a fellowship in sports medicine is. So while I would love to say that you will get all the skill set that you would, you don't get the same orthopedic exposure, you don't get the volume by any stretch, you don't get the coverage. So there's a ton more musculoskeletal ultrasound, the breadth, and we had rotations that were just literally like I'd have 3 months of the knee alone. And it's almost like you don't realize what you don't know until you actually go through an entire fellowship, and then you actually go through your practice and you realize there's still a lot of learning. So I think the level of training is just significantly different than what you would get in a residency, I would say by and large.
I do think you can pick a lot of it up. I feel like I'm learning a lot of ortho in my first 6 months as an attending. And I wasn't trained in ortho. I was more sports med. So I'm reading a lot and leaning on a lot of my orthopedic surgeon colleagues has been helpful. But we do a lot of the same things too. So there's a lot of overlap, but then there's also a huge learning curve, which I'm sure everyone will say about your first 6 months as an attending. You're really learning a lot. But I don't know if that answers the question.
I was trying to read Matt's question again and think of how to answer it. I think that the way I would answer it is the non-orthopedic aspects of sports fellowship training are taking what you learned in your family med training or your peds training or your ER training and now focusing it on how that relates to an athlete or athletic people or activity. So sometimes it's like you may learn how to manage diabetes, and that's great. But how do you manage somebody's insulin who is a track and field athlete who's competing, in multiple events over a day? So sure, you know how to manage diabetes in grandma, but do you know how to take care of that in the athlete or asthma or any medical issue? So it just builds on what you've already started to learn, focusing in on the areas that you're interested in.
And we'll try to finish this up. Go ahead. Why don't you answer that last question, because I realized I didn't answer it well for Matt. So, Cassidy, this is a good question for you. He's asking about non-orthopedic issues.
Right, and so this is kind of exactly what he's asking. So, yes, that's what I feel very confident in doing is taking care of like REDS, which is the new female athlete triad, so relative energy deficiency syndrome. So I can talk more about, relative energy deficiency in males and female younger athletes. And I feel like for pediatrics, anything around, up to college age and like early professionals, I feel like we're pretty confident with. But also the other fellowship training something. Also, just like Dave was saying that I'm normally the one in charge of insulin when people come in at a race and they have diabetes and no one wants to look at their blood sugar. So if you have that general training, you're going to feel so much more comfortable checking a blood glucose or, taking care of that anorexic female athlete or doing ultrasound.
So you get a spattering of all these random things that are non-orthopedic, exertional rhabdomyolysis, you get concussion care, some cardiovascular stuff, and so it depends how you want to market your practice and what setting you're in. If you have more primary care connections, you'll be able to do more primary care stuff. So I've always stayed within the primary care clinic, so I do some cardiovascular stuff. So anytime, for example, one of our college athletes has anything medical, our training rooms are about twice as long as those, the orthopedic training rooms. So, okay, well, Chris, I don't want to keep the group here any longer. I don't know if you want to finish up here. Or...
Absolutely. I'll go ahead and close this out. It looks like that's the end of the student questions. So I just want to say on behalf of all the students that we're really grateful you guys volunteered your time tonight to talk to all of us. I think we got a lot of great answers. And I am going to put up my email is on the webinar's homepage. If anyone has any other questions that they want to ask that they didn't think of at the time, you can direct those towards me and I'll try to get them answered for you. So yeah, with that.
Ask any questions. Sorry, I can stay after too if anyone wants to ask me questions. I apologize for being late.
Yeah, that'd be great. Someone could just type in if they want. And then also, someone asked about our emails. You can feel free to email our emails if Dave and Cassidy are okay with that. If people have follow-up email questions.
Yep. Absolutely. Well, thank you guys for getting on. And I'll stay on as well, and I'll make sure everything keeps going if anyone wants to stay on and ask more questions.
All right. Thanks, guys.
Great job, Chris, and everyone. And we'll look forward to more. We'll have another one in a couple of months.
Definitely.
Bye-bye.
Thanks so much, guys.
All right. Bye, guys. Bye, Cassidy.
Bye.
Thanks for making it. Good work.